If you are over 60 and your orgasms feel empty, your body is screaming a message you cannot afford to ignore. In the next 11 minutes, I will reveal why this happens, the hidden dangers most doctors never mention, and the simple solutions that could restore everything you thought you had lost. This information is life-changing. Stay with me. Hello, everyone. I am Dr. Angelina, and in my 11 years as a urologist, I have seen thousands of men suffer in silence over something completely treatable. Today, I am breaking that silence. We are talking about dry orgasm, when you feel the pleasure but see no ejaculation. This affects nearly 40% of men over 60, yet 90% never seek help because of shame. That ends today. By the end of this video, you will know exactly what is happening inside your body, how to fix it, and why acting now could literally save your life. Let us begin. Here is something that will shock you. Your ability to experience pleasure and your ability to ejaculate are controlled by completely different systems in your body. Most men have no idea about this. Orgasm happens in your brain. It is an electrical storm of pleasure signals firing through your nervous system. This is why you feel that intense sensation, that peak moment of release. Ejaculation, on the other hand, is pure mechanics. It is muscles contracting, valves closing, fluids mixing, and a coordinated expulsion of seminal fluid. Two different systems, two different control centers. Here is why this matters so much. When dry ejaculation happens, your pleasure system is usually working perfectly. Your brain, your nerves, your ability to feel sensation, all intact. What has changed is the plumbing, the mechanical delivery system. Understanding this one fact can instantly relieve the crushing fear that something is fundamentally broken about your masculinity. You are not broken. Your sexual identity is not disappearing. Your vitality is not draining away. A mechanical system has changed, and mechanical problems have mechanical solutions. This is fixable. Now let me show you exactly what is going wrong and how to fix it. Quick question for you. Have you been avoiding intimacy because of changes in your ejaculation? You are not alone, and I want to hear your story. Drop a comment below. Your courage could inspire another man to finally seek help. Before we continue with the solutions, do me a quick favor. Hit that subscribe button and turn on notifications. Why? Because I share critical men's health information that could add years to your life and life to your years. It takes 2 seconds and costs you nothing. Thank you. Now let us talk about the 3 main causes and how to fix each one. Cause number 1, retrograde ejaculation. This is the most common culprit. And here is the good news. It is completely harmless to your health. Here is what happens. At the base of your bladder sits a small muscular valve called the bladder neck sphincter. During normal ejaculation, this valve contracts shut with perfect timing, creating a one-way street that forces semen forward and out through your penis. But when this valve weakens, or the nerves controlling it get damaged, it stays partially or fully open during orgasm. Your semen takes the easy route backward into your bladder. You feel the full orgasm, the complete pleasure, but nothing comes out. The evidence? Your first urination after sex looks cloudy or milky white because it now contains your semen. 3 main triggers cause this. Prostate surgery, especially TURP procedures for enlarged prostate, can affect these nerves. Certain blood pressure medications, particularly alpha blockers, intentionally relax this muscle, and long-term diabetes damages the tiny nerves that control this valve's timing. The solution? If medication is the cause, your doctor can often switch you to alternatives. If nerve damage is involved, there are specific medications that can strengthen this valve's closure. And here is something crucial. Retrograde ejaculation does not harm you. The semen simply gets urinated out later. Your kidneys and bladder handle it perfectly fine. Cause number 2, physical blockage. Your seminal vesicles produce about 70% of your ejaculation volume. When the narrow ducts from these glands get blocked, the fluid cannot escape. Imagine a garden hose that is kinked. The water is there, the pressure is there, but nothing flows out. What creates these blockages? Chronic infections, especially untreated prostatitis, leave scar tissue that narrows or closes these passages. Small calcium deposits like microscopic stones can form and create obstructions. Cysts or inflammation can compress these delicate tubes from the outside. The symptoms? You might notice progressively decreasing semen volume over months or years. Some men experience a dull ache in the pelvis during ejaculation. Others notice their semen becoming thicker or showing unusual color changes. The diagnosis requires a specialized ultrasound, and the treatment depends on the cause. Infections respond to targeted antibiotics. Some blockages can be cleared with minimally invasive procedures. This is why seeing a urologist is so critical. They have the tools to identify and fix these problems. Because number 3, testosterone deficiency. This hormone is not just about muscle and sex drive. Testosterone directly stimulates your prostate and seminal vesicles to produce the fluids that make up your ejaculate. When testosterone drops below healthy levels, these glands essentially go into hibernation mode. Production slows, volume decreases, and eventually you might produce almost nothing. The clues? Reduced ejaculate volume is often accompanied by decreased libido, softer erections, persistent fatigue, muscle loss, mood changes, and brain fog. This is called hypogonadism, and it is shockingly common in men over 60. The fix? A simple blood test measures your testosterone levels. If they are low, hormone replacement therapy can restore not just your ejaculation volume, but your energy, mental clarity, muscle mass, and overall zest for life. Many of my patients describe it as getting their younger self back. Now here is the part that could save your life. While most causes of dry ejaculation are benign and treatable, this symptom can occasionally be your body's early warning system for something serious. I need your full attention here. Prostate cancer, as it grows, can physically obstruct the ejaculatory ducts. Bladder cancer near the bladder neck can do the same. These cancers are highly treatable when caught early but devastating when ignored. This is why you must know the red flag symptoms that demand immediate medical evaluation. Blood in your urine or semen, even once, even a small amount. This is never normal. Persistent pain in your pelvis, lower back, or during ejaculation that lasts more than 2 weeks. Sudden onset dry ejaculation that appears out of nowhere, especially if you are under 70. Changes in urination, weak stream, difficulty starting, frequent nighttime bathroom trips, or a feeling of incomplete emptying. Unexplained weight loss, bone pain, or extreme fatigue. If you have any of these alongside dry ejaculation, do not wait. Do not hope it goes away. See a urologist within the week. Early detection transforms outcomes. Additionally, neurological diseases like multiple sclerosis, Parkinson's disease, or severe diabetic neuropathy can damage the nerve pathways controlling ejaculation. These conditions show other symptoms too, like muscle weakness, tremors, balance problems, or numbness. If dry ejaculation appears alongside neurological symptoms, you need a comprehensive evaluation. Now, let me address the emotional damage this causes, because it is just as real as the physical aspects. I have sat across from men who believed their worth as a partner, as a man, had literally drained away with their semen. Men who stopped initiating intimacy because they felt defective. Men whose relationships suffered because shame kept them silent. Listen to me carefully. Your value, your masculinity, your ability to give and receive pleasure, these have absolutely nothing to do with the volume of fluid you produce. Intimacy is about connection, presence, touch, emotional vulnerability, and shared pleasure. The physical sensation of orgasm remains completely intact with dry ejaculation. Your partner's experience of intimacy with you is about so much more than what happens in that final moment. When you understand the medical reality, that this is a treatable physiological change, not a judgment on your worth, everything shifts. The fear loses its grip, the shame evaporates, and you can take empowered action. Here is my second question for you. What is one myth about men's sexual health that you believed for years, but now realize is not true? Share in the comments. Let us educate each other and break these harmful myths together. Let me give you your action plan right now. Step 1. If you are experiencing dry ejaculation, schedule an appointment with a urologist this week. Not next month, this week. Bring a complete list of your medications and supplements. Step 2. Get comprehensive blood work including testosterone, PSA for prostate screening, and blood sugar levels. These 3 tests reveal most of the common causes. Step 3. Keep a simple journal for 1 week. Note your ejaculation volume, any pain or discomfort, what your urine looks like after sex, and any other symptoms. This information is gold for your doctor. Step 4. Optimize your lifestyle immediately. Control blood sugar tightly if you have diabetes. Exercise for 30 minutes daily to improve circulation. Reduce alcohol and quit smoking. Both directly damage sexual function. Stay hydrated and maintain a healthy weight. Step 5. Open the conversation with your partner. You will be amazed how much relief comes from simply sharing what you are experiencing. Most partners respond with compassion and support, not judgment. Here is what I want you to remember. Dry ejaculation is not a life sentence. It is not proof that your best years are behind you. It is simply information, a message from your body that deserves investigation and response. In my practice, I have watched men in their 70s and 80s restore their sexual function, reclaim their confidence, and enjoy vibrant, intimate lives after addressing these issues. Age is not the enemy. Ignorance and inaction are the enemies. You now have the knowledge. The only question is, will you take action? If this video gave you clarity, hope, or practical solutions, smash that like button. Help me get this information to the men who are searching for answers at 2 in the morning, too embarrassed to ask anyone for help. Share this video with someone you love. A father struggling in silence. A friend who has made comments about getting older. A partner who needs to understand what you are going through. And subscribe to this channel because I am committed to bringing you the health information that changes lives, not just gets views. I am Dr. Angelina. Taking care of your health is not optional, it is essential. Seeking help is not weakness, it is strength. And living a full, vibrant, sexually healthy life at any age is not just possible, it is your birthright. Do not let another day pass in silence and shame. Take action. Your future self will thank you. I will see you in the next video. Stay strong, stay informed, and stay healthy.